This program is rated PG. It contains themes and scenes which may not be suitable for very young audiences. Parental guidance is advised.
Be advised that the views and opinions of the hosts and guests do not reflect those of the station.
Good afternoon, Philippines. You're watching the Business Portal, your gateway to health, beauty, trends, and opportunities. I'm your host, Dr. John Seneca for What's Up, Doc? Yes, and what a shiny and warm afternoon we have for today. And before anything else, I would like to introduce to you my co-host, an icon in cosmetic surgery, no other than Dr. Rayron Lau.
Yes, good afternoon, Dr. John Seneca.
Yes.
And good afternoon to all the televiewers of GNN, especially ang ating program,
What's Up, Doc?
Oh,
Yes.
First episode natin to for the month of
Exactly.
April.
Alam mo ba, next week, 7th year na natin.
7th year.
So, dapat meron tayong konting celebration next week.
Tsaka siguro may mga pa-cake siguro sana dito tayo.
Ayan,
no?
courtesy of Global News Network.
Yes,
Ayan.
thank you for having
Alam mo,
us.
talagang nakakaano dahil sa ang daming yung nangyayari. Recently, alam natin may mga insidente na minsan masasabi kong it's just an accident. No?
Yes, oo.
And we have a very, I could say, an honorable guest, an icon in liposuction surgery and cosmetic surgery. And they will know the real thing all about liposuction.
Yes, medyo may connection ng kaunti sa mga past na nangyari. And ito lang is to enlighten our televiewers and the people kung ano talaga yung safe, ano dapat, ano ba itong ginagawa
The
natin.
do's and don'ts.
Yes, oh, exactly.
We call it liposuction, what you need to know.
Yes,
Ayan,
ang topic
oo.
natin. Napapanahon talaga yung
Napapanahon,
topic natin
no?
ngayon.
Tama-tama. At,
And napakaganda siguro na yung guest natin dahil ito yung mga pillars of cosmetic surgery and liposuction
Mga
surgery.
icons to.
Yes.
And before anything else, if you have any question regarding our topic, liposuction, what you need to know, you can also text us at 0925-852-0815 right there, focus on your screen. Please indicate your name, your location, where you are right now. And before anything else, I would like to tell that you're gonna receive a
Gift
2,000
certificate. Yes.
pesos
Oo.
worth of gift certificate.
Sa 2,000, pwede ka na yata magpalipo ba? Hindi pa yata.
Pan-down,
Konti
pan-down,
ba? Oh,
pan-down
ipon lang kayo
payment.
ng gift certificate dito sa
Pan-down
show.
payment,
Oo,
pwede siguro.
na tayo dyan.
2,000 worth of gift certificate courtesy of Johnson Cosmetic Surgery.
Yes,
For
so
the lucky texter.
pipiliin po natin yan at the
pipili
end
tayo.
of the show mamaya.
Ang pipili po ay si Catherine.
Si Catherine,
Ayan,
ang
siya
ating,
bibigyan natin ng role
floor
para pumili kung
director.
sino man ang mananalong lucky texter. So, text lang. Ha? No, don't call, ha? Hindi kayo mananalo pag tumawag kayo.
Text lang po kayo.
Text lang po.
Yes.
And of course, we are broadcasting live here at Global News Network in Makati. And tomorrow, of course, there will be a replay of this program 1 to 2 o'clock.
Same channel, of
Yes,
course.
and
Siguro,
introduce na natin ang ating guest.
Para masimulan kasi napakadami natin pag-uusapan, no? Para
Oo, naku, baka mamaya napakadaming
siguradong
interesado
bitin na naman tayo dito. Pero simulan natin. Okay, our first guest is immediate past president of the PSLSI.
The Philippine
or
Society of Liposuction
yes,
Surgery. Oo.
Philippine Society of Liposuction Surgery and president of the Philippine Society of Cosmetic Surgery. No other than the ever-glowing Dr. Chari Bellecer. Good afternoon,
Good afternoon,
Doktora.
Chari.
Good afternoon, John and Ray. Thank you for inviting us this morning or this afternoon to your very popular
We're
program.
live, ha? We're
Yes.
broadcasting live, yeah.
Yes.
And of course, the mother of all cosmetic surgery in the whole
Yes.
world. Globally, hindi lang sa
Wow,
Pilipinas.
Ito yung icon talaga in
Icon.
cosmetic
Oh, the
surgery.
real icon.
Yes,
Ayan.
tayo nagpapanggap lang tayo.
Alam mo ba yung yung picture doon sa American Society of Cosmetic Surgery, Philippine Academy of Aesthetic Surgery, kamukha ni Ma'am.
Din
Oo,
yata
yung
kinuha.
logo na, yung mukha na yun.
Oo,
Oh,
din
yan
yata
yung binigay
kinuha.
nating nung last time.
Yes, so
Oo.
it's an honor to have Doktora as our guest today.
Next is will be the founding president of the Philippine Society of Liposuction Surgery Incorporated, no other than the icon in the mother of all mothers, no, the mother of beauty, Dr. Corazon Collantes Jose.
Good afternoon, Doktora.
Magandang
Good afternoon,
hapon
John.
po, ma'am.
Good afternoon, Ray.
Yes, opo. And thank you for napaunlakan niyo po kami na mag-guest dito sa aming show.
And it should be an honor for us. And alam niyo ba ngayon, napaka-controversial ng ating pag-uusapan ngayon.
Yes,
Because we'll be talking about liposuction.
Yes,
Oo. Ano ba itong liposuction, Dr. Bellicer? Ano ba? Nalilinig natin ito eh. Oo. Ano bang importance ito sa buhay ng tao?
Well,
Dr. Bellicer?
liposuction is removal of unwanted fat
Unwanted
in
fat.
different areas of the body for aesthetic reasons.
Okay. Oo.
Pag sinabi mong unwanted fats, Doktora, ito ba kunyari, sasabihin ng doktor, unwanted yan. Paano malalaman na isang pasyente or
Na
tao
ito'y unwanted?
unwanted na pala yung fats na
Oh,
yun?
if you look at yourself in the mirror, you will see those fats that are protruding which you don't want
Okay.
existing in your body, in your physique. Yun ang mga unwanted fats. Pwede ito sa chin, pwede sa face, pwede sa arms, pwede sa chan, pwede sa likod,
So anywhere.
pwede sa thighs, anywhere in the body
Oh.
Is there a
actually.
difference, Doktora, between unwanted fats and yung cellulites na tinatawag?
Oh yes, yung unwanted fats, nasa ilalim yon
Okay.
nung area ng cellulites which are really on the epidermis and until the dermal layer. Yung unwanted fat, ito yung nasa ilalim, nasa subcutaneous area na
Mas
tinatawag.
malalim pa.
Subcutaneous area.
Yes,
Oo.
it's a little bit deeper.
When you say subcutaneous area between the skin and the muscles.
And the
it's
muscle.
just
That's
between
where
that.
the subcutaneous fat is located.
Sino naman po ang pwede na say candidates for liposuction surgery, Dr. Jose? Sino po ang mga
Potential candidates
po for
for liposuction
liposuction surgery?
Well, yung excess fat, yung may excess fat, tapos yung mga from age to, usually yung pinaka-youngest na ginawa ko was age 16.
16 years
Oo,
old.
yung mayroong unwanted fats, yung mga saddle bag. Yung mga
Saddlebag,
Yes.
ito yung nasa may tagiliran
Nasa
dito po.
tagiliran.
Okay.
Yeah.
Na nagbibigay sa kanila ng mental anguish kasi miski magdamit sila, nakausli yung kanilang taba doon sa bandang
Yung pantalon
hips.
hindi
Oo,
magkasya.
hindi
Yeah.
magkasya. Yun. Kung nagme-mental, mental lapses na yung mga bata at ayaw nila ng fats na yon, para hindi na magkaroon ng problema yung bata at ginagawa nilang issue yun sa kanilang buhay, ay inaalis na
Kasi
yun.
there's a factor minsan na, kunyari sa school, like you said, Dr. Rose, 16 years old. Like ngayon, medyo nauuso yung bullying na tinatawag eh, no?
Pag mataba ka, sinasabi siya,
nabubuli ka
taba,
sa school.
taba.
So minsan yung pasyente, yung bata, para nagkakaroon ng...
Inferiority
yes,
complex.
exactly.
Oo,
oo.
yun.
So pwede pala, Doktora, at 16 years old, pwedeng i-live po.
Pwede naman. Oo, basta usually naman under local sedation lang naman yon at saka localized naman yung fats na yon. Miski syringe lipo, kayang-kayang
Ayun,
alisin
mamaya
yun.
i-discuss natin yung types of anesthesia mamaya sa
Correct.
liposuction.
Oo.
no?
Kasi, overweight is a big problem here in globally,
Yes, oo.
and it's considered right now as a disease, ang obesity. In liposuction ba will reduce the weight of a person? Kasi ako gusto kong mataba ako, sobrang taba, gusto kong magpa-lipo.
Ang laki ng timbang.
Will you
kumbaga.
accept them as a patient and let them undergo liposuction surgery?
First of
Dr.
all,
Bellicer?
when a patient comes in and he or she is overweight, they're always asked to try to reduce their weight. Kasi liposuction is not for weight reduction.
Okay,
yun ang
okay.
gusto
Para
nating
sa
i-emphasize.
para
no?
sa malinaw sa
That
ano,
liposuction is not a weight-reducing procedure.
Yes,
Okay?
exactly.
Para saan po ang liposuction?
Yung sinabi ni Dr. Jose, it's for excess unwanted fat
Unwanted fats.
on certain areas of the body, which I mentioned earlier.
Okay.
So ito, I have a question kahit sino po sumagot sa inyo. No? Ito very popular kasi pag nagbuntis, alam niyo naman ang babae, medyo anxious agad na bumalik into their normal forms agad.
Yes.
How soon after the pregnancy po can they undergo liposuction procedures?
After giving birth.
Yes.
Ilang
Ako kasi-
buwan po, ilang weeks, or...
Ako kasi yung kung unwanted, yung kanilang fats na yun, at saka kapapanganak lang, takes me about 1 year.
One
bago ako
year.
mag-umpisa.
So you advise that after
Oo,
1 year?
kasi bukas pa mga sinuses na around that area, you know what I mean? Pwede ka mag-fat embolism doon, pwede ka
Oh.
Kaya ako kung di sila talaga, tsaka pwede pa naman sila mag-reduce
Yes.
Pag malaki ang tiyan nila, pwede pang mag-reduce muna. After 1 year, tsaka lang
Tsaka kasi
ako
baka may swelling pa ng because of the pregnancy.
For pregnancy.
Siguro maganda nga talaga sundan yun
Tsaka,
ng 1 year, no?
At saka
One year
kailangan
after,
talaga
yes.
hindi nyo nakikita yung mga varicose veins.
Yeah.
Kasi pag meron mga varicose veins sa tiyan, sa ganyan, ay hindi ko ginagawa ng liposuction yun kasi pwede kang mag-fat embolism
Oh.
doon.
When you say fat embolism, ano magandang topic to yun?
Yes,
Narinig
oo.
natin yan. Alam natin yung fat, ano ba ibig sabihin ng fat embolism, Dr. Barriaser?
Yung fat that migrated to the vessels,
Okay.
through the vessels to the damaged vessels, yung fat na yan pwede kasing pumunta sa lungs.
Sa lungs?
And it may cause pulmonary
Embolism.
syndrome. The pulmonary embolism signs and symptoms. It can also progress, no? Pwede maging fat embolism syndrome yan, characterized by the triad of lung manifestations, characterized by CNS or central nervous system manifestations, and as well as skin manifestations, and even retinal lesions.
Yeah.
So that is yun na yung pinakagrabing form ng fat embolism pag naging syndrome siya.
So, fat embolism, Doktora, is, masasabi ba natin it's a form of complication of liposuction? Can we say that?
It may be a form of complication of liposuction. But then again, it doesn't happen to everyone.
Yeah.
Depende yan kung may mga risk factors yung pasyente.
So what would be the risk factors for patients who there's a possibility of developing fat embolism?
Ito yung mga pasyenteng may history ng deep venous thrombosis. Ito yung mga may pasyenteng may kasasabi lang ni Dr. Jose, maraming varicosities.
Yes. Oo.
Ito yung may mga risk factors yan.
Ayun.
Or yung mga, palagay mo na, yung mga nagpipills.
Oo.
Kasi pwedeng magkaroon
Hormonal
sila
pills,
yes.
right.
O yung
Isang kasi
pills.
sa hormonal pills, yung estrogen hormone. Because I'm lecturing about varicose vein treatment. Sinisira niyo yung tinatawag na tunica intima, yung pinaka-wall ng blood vessels. Then eventually, sabi mo nga, pag na-rupture, nagkaroon ng damage na sa blood vessels, when you do liposuction, it might penetrate on the bloodstream or tinatawag na ugat po or daluyan ng dugo at bumara ito doon sa lungs, sa brain, sa retina, sa heart. It might be one of the cause of death. Yes.
Pag may mga risk factors kayo, Doktora, like for example, sabi niyo may DVT, may mga varicose sa tiyan, is that an absolute contraindication? Kumbaga, bawal ka na magpa-cosmetic surgery or
Pag meron ka
liposuction
ng
surgery
varicose,
for the
depende.
rest of your life? Or anong pang pwede nating gawin para mapa-operahan pa rin sila?
Ay, talagang may varicose veins, hindi ko na pinapakialaman.
Oo, talagang oo.
So, safe side talaga
Talagang
muna.
safe
Yes,
side ako.
number
I'm
one.
sorry, but if they would like to take a risk, I don't take risk, you know.
So,
In short, it's better to be safe than sorry.
yeah, so number one
So what
priority
would be
natin is safety.
some
yes.
other potential risks of liposuction surgery?
Well,
Doktora.
kung sumusobra ang kuha nyo ng taba, kasi may limitation yan eh.
Oo, yun.
Yes,
How
so,
much is how much? Oh.
Sa akin, the most is 2 liters. Pagka
2 liters.
nagti-3 liters na ako, ay may conservative operator, no?
Oh, yeah.
Pag 3 liters nang aalisin ko sa fats na sa katawan, meron na akong blood transfusion na
Nakaabang.
blood ready just in case
Yes.
magkaroon ng hypovolemia ang pasyente o di kaya bumaba ang blood count ng pasyente.
Correct.
Ready ka na, hindi magtatatakbo ka pa.
Yes.
You know what I mean?
Is there a difference, Doktora, if it's a male or a female ang pasyente? There's a difference ba ng, okay, pag female, hanggang ganito lang po, 2 liters. Pag male, tapos medyo bulky naman, pwedeng umangat ba ng kaunti po yun? O same lang po?
Para
Parang
sa akin,
generalized.
2 liters is the safest. Anything more than that is already
Merong risk na.
May risk na.
Okay.
How about, let's say, Doktora Ballecer, let's say, pasyente kailangan talaga more than 2 liters. So, parang we just limit ourselves to 2 liters and then patient have to be back after like what? Few weeks or few months for
Well,
another set of liposuction procedure.
Going back to your previous question,
Yeah.
ako, ang guideline ko, I remove 4 to 5% of the
Total
the
body.
total body weight. For example, 50 kilograms siya, 4% times 50 kilograms, that's 2 liters.
Tama.
2,000 cc's, yun ang sinasabi ni Dr.
Correct.
Jose. Ngayon, kung talagang maraming kailangan alisin sa kanya, it's best to do sequential liposuction. Every 3 to 4 weeks would be fine.
3 to 4 weeks.
3 to 4 weeks.
3 to 4 weeks.
Okay, okay.
Oo. Kasi minsan nga, ang pasyente, they expect too much. It happens to me kasi I have a patient, alam niyo mga women from Saudi Arabia, they're really big,
They're
you
really
know.
big.
They want to have these arms done, they want to have these legs, abdominals. Arms pa lang 1 liter na nakuha ko. And then,
2 liters
hindi pwede tayo mag-over to the limit. And it was, the procedure was done December, and then I repeated it February na. And the patient was very happy. It's very easy to say that liposuction can remove those unwanted fats. Kaya lang, sabi nga ni doktora, may limit. No?
Correct.
Oh,
Oh,
it's
yeah.
better
Don't
to
expect
be
too much.
safe.
Because there's a big expectation na, pag mataba ka, palipo ka na. Ganun. Hindi ba pwede muna yung, mataba ka, mag-diet ka muna. Di ba? Usually, liposuction na agad ang naiisip natin na procedure. Because this procedure was also popularized by the celebrities, probably the friends and relatives who undergone this kind of procedure. Ma'am, ito bang procedure ng liposuction? Mahirap ba to? I mean, masakit ba to? Ano ba, pwede bang umuwi kagad ng pasyente o kailangan sa hospital gawin or sa isang ambulatory surgical unit? Yes, ma'am.
Actually, ang liposuction is just skin dip yan eh. You know,
Skin
hindi
dip.
mababaw
Ibig sabihin,
lang
nasa
yan.
ilalim lang
Underneath
ng
the skin.
balat.
Ilalim lang
Yes,
yan.
oo.
It's a fat.
It's just ang risk nito is how much fats you are going to remove. Yun lang naman ang risk dyan eh.
Yes.
But the procedure is a very versatile procedure. Masarap nga mag-liposuction, honestly. Actually, I've been doing liposuction for the past 40 years.
40 years.
40 years, wow.
And I am going to tell you, I've never had any problem. Why? Because I followed the parameters of lipo.
Oh, yun.
At saka, anong pangalan to? Hindi naman ako pareho nung iba na masyadong magyayabang at mangangako sa pasyente na
Yes, ma'am.
mapapaganda niya yung katawan
Correct.
and getting more than what is necessary without
Yes.
any precautions.
So, ang
That's true.
pinaka-isa sa
Precaution.
natutunan ko agad ngayong tanghali is always on the safe,
Safe side.
Kumbaga,
On
if
the
you
safe
follow
side.
Dr. Jose, she's been doing this for 40 years.
40
40 years, wala pa ako naging
10 years old pa lang
complication
ako
at
nun.
all. You know what I
Oo.
mean? Kasi nga, sa dami ng niliposuction ko. Unang-una ako nag-liposuction, 1985 pa eh.
Yes.
So,
I was
can
2 years
imagine.
old back then, Dr.
2 years old, ilang taon na yon, you know what I mean?
Exactly.
Yes,
Halos,
oo.
nung panahong una, halos araw-araw yata kami nagla-liposuction nung araw. You know what
Talaga?
I mean? Nung mauso yan, liposuction na yan, halos
Yes,
araw-araw. But as long as you follow the parameters of liposuction, nobody should get any complication.
Wow, yun. Very
We
well
have a
said.
texter from cell phone number ending at 5236. Dr. Lau.
Yes. How does liposculpture differ from other liposuction methods? Siguro kay Dr. Achari ito.
Liposculpture and liposuction, ano difference?
Okay. Pag nagla-liposculpture ka sa pasyente, you're actually sculpturing the whole body.
Curving.
Okay.
You know, you're trying to put the curves in the proper
Yes,
places.
yes.
Usually, these patients who undergo liposculpture are not really overweight. That's the first. They just want certain areas of the body treated, like malaki yung arms ko, malaki ng konting thighs ko, malaki ng konting abdomen ko, tigkakaunti. So what you do is you liposculpture it para makakuha siya ng figure na desired niya.
Yes. Kunyari yung love handle na tinatawag.
Handles.
Pag linay po mo ng kaunti lang, pero pag nag-dress yan after, yun talagang medyo
Yes.
bakat na bakat na.
Yes, gumaganda yung curves niya. O kaya yung saddlebags that was mentioned earlier ni Dr. Jose. Ano to? It's a form of lipodystrophy. Usually, it's
Right.
genetic. So yun, alisin mo lang ng kaunti yun. You don't overdo things. When you do liposculpturing, you don't overdo things. Because usually, the patients would expect you to remove a little from every area.
Right.
And again, if we're following the safety parameters, as much as possible, it has to be around 2 liters. If you have to exceed, konti lang yon. Because to start with, the patient is not overweight.
Yes. Wow,
very well said.
Can I add some more?
Yes, sige
Yes,
po,
ma'am. Yes,
Doktora.
ma'am.
Sa akin, para maging successful ang liposculpture, positioning is very important.
Position.
Wow.
Yes. I agree with that.
You have
I
to
with
agree,
you, ma'am.
you have to position them in such a way that kung saan nandun yung unwanted parts, make it more prominent and pronounced so that you can liposuction it well. Okay, so positioning to me should never be forgotten when you do liposculpture.
Yes.
Another question is that, is liposuction, is there any certain part of the body that cannot be done with liposuction procedure, or is there any only indication of only certain parts
Certain parts of the body lang.
And we'll answer that after these few reminders.
Natural look nose lift, cleavage by breast augmentation,
curves by liposuction. Non-surgical treatment of varicose veins. Janssen Cosmetic Surgery by Dr. John Seneca.